Welcome to this special show on Corona on mental health at the Global Governance News TV. Just we have the panelists and we'll discuss about the Corona. You know, the Corona mental health is a great problem nowadays, and they were facing day by day the great problem of Corona in India and outside India. If you see, this is a 1918 that was a pandemic. This is 2021. This is also pandemic. That time the plague was just from the French plague that was called. Now this is a Corona, China, Wuhan, Corona virus. So the history will know, the time will know, and just blame just goes to the China. And here we are here just to discuss about the what is the effects after the Corona on the mental health globally and India also. If you see the data of the India, ni- ni- 92 till 2017, the graph is just increased like anything. At present, 14% of population just the crossing and the facing the mental problem, that different type of diseases, mental problem, with the and mental. So we are here. We'll discuss the mental health of the India as well as the so we have the panelists, and we're waiting for the two more doctors from the USA and Germany. Later on, they will join us. So we have Acharya Shailesh Tiwari ji. He's a Tantra guru. We say in India, just Tantra science. There is a science, not the spirituality and way. We have Dr. Akshita Gupta. She is a BHMS, MD in psychiatry. She has a lot of work done in the psychiatry, and every day she has been just curing and just taking consultation the many patients in India and abroad. We have just joined Dr. Raj. We have Dr. Raj Bhayani. We have Dr. Raj Bhayani. He is the chairman of the Federation of Indian Physicians in US. We have Madam Alankrita. She is a cosmic healer and tarot card reader, and she has also just seeing and trying to cure so many patients of the mental problem. We have Anita Chaudhary. She is senior journalist, also keeping eye on the latest development of the Corona cases and how this reporting will. So now we'll start from Dr. Bhayani. Just how just see the cases of US is increased a lot. If you see the cases 2019, the case was 11%, 19%. Now in US data is increased to 41%. So how just India, US, and globally, and there is so many change, and the World Happiness Index also. So please just try to just enrich us how just cure the mental health problem, how the peoples are facing from the Corona, how we are doing that. Dr. Rajbhayani.
Good evening, everybody. It is my pleasure and honor to join Global Governance News on this wonderful subject, which is absolutely essential to be discussed now, as the Corona pandemic have caused various mental diseases. It has caused the mental disease in the patients. It has caused the mental disease in the actually providers, or what we call the physicians or the healthcare workers. It has caused the stress and anxiety and other mental problems with even the politicians and government who are dealing with this problem. And so the first and foremost important issue is the how do we diagnose that person has a problem? That is the most important critical part. And then comes the management issue. So for the diagnosis, we have to see what symptoms they have, and feeling of fear, anger, sadness, worry, feeling of loss of appetite, loss of energy, loss of desire, loss of interest, difficulty in concentration, difficulty in sleeping, nightmares, headaches. The psychiatric diseases also manifest as actually symptoms on the body, as if you have headaches, your body pain, your stomach pains. And what happens is if you have any pre-existing conditions such as hypertension or heart problem, actually because of stress, those conditions will get worse. And if you have pre-existing mental health, it will even get worse. And what has also happened is there is an increase of the substance abuse, which is people are taking more alcohol, more smoking, and more drugs during this time. And so these are the various symptoms people will have as a mental health problem. And now we have to see that how it is affecting the general population and it is affecting the physicians. As physicians are overworked and healthcare workers are overworked, there is a burnout, and that burnout is causing tremendous stress on the physicians all over the world. This is not a problem unique with India, it is all over the world. And so identifying the problem is a critical part. And some of these issues are actually caused by the virus itself. Suppose you actually have a COVID, the fear of dying itself will cause tremendous psychological impact. Now, if somebody close to you has a COVID, that is another different psychological problem. And seeing the death in general in society will have different psychological problem. And inability to provide the right care to the patients. When patients are coming to physicians, and at some point you have tried everything and you can't do anymore, that anxiety and that stress and that frustration will cause a different psychological problem. So as you see, there are different levels of psychological problems and different issues with different people, group of people. So we have to dissect these down and address these issues as it comes. So this will be my, I guess, synopsis. You want me to get into the management? I can, but Rakeshji, I want to know how much time we have to discuss this. Yes. Thank
No,
you.
no, we have just about 1 hour. So all the panelists will listen. Acharya Shailesh Tiwari ji also. He's a
Yes.
highly spiritual leader and the great person and honored by the all premier of the country and the world. So either just after you. So first I'll take the picture of the India and the mental health. Dr. Akshita Gupta. She is MD and secretary and practicing uh, secretary and seeing just the condition of the patient in India. So I will take the stock situation from Dr. Akshita Gupta, then I'll talk to Acharya Shailesh Tiwari ji how to cure, and then Alankrita ji how to heal the patient, how that they are facing the person. Then Rakesh Tiwari ji from the Canada, he's a journalist from Canada, just joined us. His network today is very good now. With the, I think the Dr. Bhayani has give some inspiration. So his network is very good now and stable now as comparative to other day. And he has a special case of the mental health. He has lost his son due to this mental problem due to the hospital in Canada. So that's why we invited him especially in this program. So, Dr. Akshita Gupta, just what is your inputs and how just you see the mental health problem in India and around the globe in the COVID pandemic?
A very good evening and thank you for welcoming to Global Governance News today. Thank you, Dr. Raj Behani, for giving us an insight to the symptoms and what people are facing in these present times. So, first of all, I would like to tell everyone must know what is mental health. Mental health, as defined by WHO, is a state of well being in which the individual realizes his or her own abilities, can cope with mental stresses of normal life, can work productively and fruitfully, is able to make a contribution to his or her community. And in these times, wherein in the past, what we have seen, mental health was never taken care. So, as we know now, the mental health is being suffered. Every one of us is suffering this. So, we are thinking now we are coming to is ki mental health is important, which has been always been ignored in past, always being ignored. Now, this mental health is considered the prime most because what we see on physical plane is just an expression of what we are thinking, what we are doing. It's all what is going in on the mind. So everything originates from the mind. So I would like to discuss here is mental health in different ages. What all of us are facing. whether they are students, whether they are toddlers, whether they are old age, whether they are adults. From 0 to 70 plus, everyone is suffering. It's none another, no one is left. In these times, COVID times, no one has been left. It's whether you take this 3 4 years old, they have been affected badly. They don't know schools, they don't know what to do, they are becoming irritable, cranky. I have so many patients, they are becoming cranky, or they just won't want the laptops, they just want the iPads, they just don't want to hold the pencil because they have never seen anything. Everyone is worried कि कब वो school जाएंगे, when they will return to school, will there be a school, will or will not be. Yesterday it was announced that exams will not be there. Now the children are like, how will be the grading done? So every time, everything that is happening is building stress. Every point, it is just stress, stress, and only stress. So it's very difficult in these times. How to go about it, how to think
Doctor,
about it.
okay, Dr.
Yeah,
Akshita,
yes.
just which type of patients just you're facing in the more just depression,
More
anxiety, and yeah, which type of patients?
mostly patients that I am seeing nowadays are anxiety attacks, they are panic attacks. As they hear someone, they go in depression. कि कहीं ये मेरे साथ तो नहीं हो जाएगा? I will not be suffering. If it happens to me, it will not happen to my family. Will I get oxygen? Will I get the medicine? Will I be treated finely? Because everyone knows that medicinal people, the persons in hospital are also very tired. They are trying their best, doing their best, but still survival is becoming an issue. It is like they fear going hospitals. They think if they go to hospital, will they be back? So that is a taboo which is in their mind. They see the
Okay,
news, then they fear that.
okay. So nice. I'll come to you again. Just I'll Acharya Shailesh Tiwari ji. In
Definitely.
this in pandemic time, what type of just rituals, what type of meditation just you refer, and how the patients should be cured with the mantras, with the meditation, and what type of techniques you just suggest to the people of the global society, not in India, just globally. Just how do you think just this type of thing, this type of the tantras or mantras will cure the person? There is a history of the Indian culture, so we have so rich about that. So please just enrich us. Just unmute your mic, Acharya ji. अगर वो हो गया.
Hare Krishna, everyone. First
Yeah.
of all, I am very thankful to Global Governance News Chief Kumar Rakesh ji, Akshita Gupta ji, Rakesh Tiwari ji, and all the dignitaries who is here and who is listening my words. Corona pandemic shows that this is not personal problem. This is the problem of whole world. That's why our spiritual books are mentioned Vasudhaiva Kutumbakam. पूरी धरती जो है वो हमारा परिवार है.
आप लैंग्वेज एनी लैंग्वेज यू कैन यूज आचार्य जी, हिंदी अंग्रेजी नो प्रॉब्लम. आपको जिसमें कंफर्टेबल लगे यू कैन स्पीक, नो प्रॉब्लम जी, कोई दिक्कत नहीं.
हमारा सनातन पद्धति वसुधैव कुटुंब पर विश्वास करता है और आज इस कोरोना वायरस महामारी ने यह सिद्ध कर दिया कि पूरी पृथ्वी हमारी परिवार है. वह किसी जात पात और किसी धर्म और किसी देश की सीमाओं से नहीं बंधा हुआ है. इस कोरोना वायरस की महामारी में आज पूरी दुनिया इस चपेट में है. पूरी दुनिया के लोग परेशान हैं और आज जरूरत है मेंटल स्ट्रेस को कम करने का. सबसे पहले अपने आप को, आप जिसे भी मानते हैं, चाहे वह गॉड को मानते हो, ईसा मसीह को मानते हो, इस्लाम धर्म को मानते हो, हिंदुइज्म में हिंदुत्व के किसी भी देवी देवता को मानते हो.
I request all the panelists just mute your mic. I request all the panelists mute your mic first. So the subject echo problem not there. Please mute your mic. Okay आचार्य जी, धन्यवाद.
राकेश जी, इस कोरोना वायरस महामारी में सबसे पहले व्यक्ति को मन से यह आत्मविश्वास बनाना पड़ेगा कि हानि लाभ जीवन मरण यश अपजस सब होत विधि के हाथ, सारा कुछ ईश्वर के हाथ में है और अपने आप को सरेंडर कर दें। मुझे कुछ नहीं होगा, अगर यह मन में धारणा बना लें कि मैं इस वायरस से पूरी तरह से लड़ करके जीत जाऊंगा, तो विश्वास मानिए 99% लोग इस कोरोना वायरस की महामारी में डर के मर रहे हैं। व्यक्ति के डरने से व्यक्ति की इम्यूनिटी कमजोर होती है, व्यक्ति का ऑक्सीजन लेवल कमजोर होता है, व्यक्ति के जो मेंटल स्ट्रेस है वो ज्यादा बढ़ जाता है, ब्लड प्रेशर बढ़ जाता है डरने से, व्यक्ति के डर से हार्ट अटैक हो रहा है। इस कोरोना वायरस महामारी में जैसा कि मेरे पास भी प्रतिदिन 100 से ज्यादा कॉल्स आते हैं, जिसे कोरोना हो जाता है सबसे पहले वह पूछता है कि आचार्य जी मुझे देख करके कुंडली से बताइए कि मेरी आयु कितनी है। मैं उस व्यक्ति को बताता हूं कि अभी आयु आपके 30 साल और है, तो वह व्यक्ति 100% कोरोना वायरस से जीत करके वापस आ जाता है। मेरा मानना है कि इस कोरोना वायरस की महामारी में किसी भी व्यक्ति को यह कोरोना हो सकता है, इससे डरने का नहीं है, इसमें सतर्कता रखने की जरूरत है और इस महामारी में अपने दिनचर्या को ठीक करें। ईश्वर ने समय दिया है, इस समय का सदुपयोग करने की जरूरत है। आप पुराने पदचिन्ह जो है हमारा सनातन पद्धति का, उस पदचिन्हों पर अगर आप चलते हैं तो विश्वास मानिए इस कोरोना वायरस महामारी पर विजय प्राप्त कर लेंगे। सबसे पहले आप अपनी दिनचर्या में सोने का जो एक रूटीन है वह 6 से 8 घंटे तक सोए, शयन करें, खान पान पूरी तरह सात्विक करें, किसी भी तरह का अल्कोहल का उपयोग ना करें, मांस मछली का उपयोग ना करें, पूरी तरह से सात्विक फल फ्रूट सब्जियों का उपयोग करें। और इसके साथ साथ इस कोरोना वायरस महामारी में एक जो सबसे महत्वपूर्ण बात है, आज मेडिकल साइंस ने भी यह प्रूफ कर दिया है कि जो कोरोना मरीज होते हैं उनका लंग्स कमजोर होता है, लंग्स कमजोर होता है, हार्ट पर असर पड़ता है। तो मेरा मानना है कि शंखनाद एक ऐसा माध्यम है जिससे मरीज को पूरी तरह से राहत होगी। शंखनाद करने से, प्रैक्टिस करने से व्यक्ति का लंग्स फूलना और सिकुड़ना, उससे लंग्स की मजबूती होती है और साथ ही साथ इम्यूनिटी बूस्टर के रूप में शंखनाद काम करता है। तो प्रत्येक व्यक्ति को शंखनाद करनी चाहिए। मेडिकल साइंस भी अप्रूव कर दिया और मेडिकल साइंस में भी लोग बताते हैं कि जिस मरीज को कोरोना वायरस महामारी होती है उन्हें बैलून फुलाने के लिए दिया जाता है। मेरा मानना है कि आप शंखनाद प्रतिदिन करें, प्रतिदिन आधे घंटे आप प्राणायाम करें, आप चाहे अनुलोम विलोम करें, कपालभाति करें, योग प्राणायाम, सूर्य नमस्कार करें और अपने अंदर यह आत्मविश्वास भर लें, आत्मविश्वास से अपने आप को मजबूती कर लें कि मुझे इस बीमारी पर पूरी तरह से विजय प्राप्त करना है, चाहे कुछ भी हो जाए मुझे कुछ नहीं होगा। तो मुझे लगता है कि व्यक्ति कोरोना वायरस की महामारी पर विजय प्राप्त कर लेगा। यहाँ पर उपस्थित डॉक्टर राज भयानी जी को भी मैं साधुवाद करता हूँ, उन्होंने भी बहुत अच्छे शब्द बोले हैं। अनीता चौधरी जी को भी साधुवाद करता हूँ और वो आगे लोगों को अच्छा बताएंगी। बहन अलंकृता मानवी जी को भी मैं साधुवाद करता हूँ और मैं यहाँ पर उपस्थित सभी लोगों के लिए मैं माँ भगवती से प्रार्थना करता हूँ कि सब दीर्घायु हो, स्वस्थ रहें, सबके जीवन में कोरोना वायरस से लड़ने की शक्ति प्राप्त हो। कोई अगर इस वायरस में फंस चुका है तो इससे बाहर निकले और अगर कोई व्यक्ति नहीं फंसा है तो वह कभी ना फंसे। इस महामारी में सबसे पहले आत्मविश्वास की जरूरत है। आत्मविश्वास की अगर आपकी मजबूती होगी तो विश्वास मानिए यह वायरस आपको कुछ नहीं बिगाड़ पाएगा। मैं आपको उदाहरण के तौर पर ऐसा बता रहा हूं कि ऐसे हमारे जीवन में 50 से 100 व्यक्ति हुए जिनको मैंने मेंटल थेरेपी दे करके उन्हें बताया कि यह वायरस कुछ भी नहीं है, सिर्फ एक फ्लू है। जैसे बचपन में आपने एक बुखार को देखा, उसको झेल करके आप 3 दिन में स्वस्थ हो जाते थे, उसी तरह आप इस वायरस से आप बाहर आ जाएंगे। तो विश्वास मानिए ऐसे बहुत सारे लोग हैं। सिर्फ मेंटल थेरेपी के कारण मुझे यह लगता है कि आज जो आपने विषय रखा है मेंटल कोरोना एंड मेंटल हेल्थ, यह बहुत अच्छा विषय है क्योंकि आज मेंटल स्ट्रेस लोगों को बढ़ जा रहा है। लोगों को अगर कोरोना नहीं भी है तो वह न्यूज चैनल देख करके अपने अंदर सिम्टम्स देखने लगते हैं। आप अपने घर पर बैठ करके कम से कम 30 सेकंड से 45 सेकंड तक श्वास रोकने की एक नियमित रूप से रूटीन बनाइए। श्वास लीजिए और छोड़िए। 15 से 20 सेकंड, 30 सेकंड, 45 सेकंड तक आप श्वास रोक करके देखिए। विश्वास मानिए आपका इम्यूनिटी भी मजबूत होगा। शंखनाद भी मैंने बताया। इसके साथ साथ जो व्यक्ति अगर इस कोरोना वायरस में फंस चुके हैं, उन्हें महामृत्युंजय मंत्र या भगवान शिव जो मृत्यु के देवता कहे गए हैं, मृत्यु पर विजय प्राप्त कराते हैं, ओम नमः शिवाय अथवा ओम त्र्यंबकम यजामहे सुगंधिम पुष्टिवर्धनम उर्वारुकमिव बंधनान् मृत्योर्मुक्षयमामृतात्, इस महामंत्र का अगर आप जप करते हैं तो विश्वास मानिए हमारे वैदिक सनातन पद्धति में बहुत शक्ति है। हमारे वैदिक सनातन पद्धति शुरू से शक्तिशाली रहा है और आज हमारे वैदिक सनातन पद्धति को पूरी दुनिया फॉलो कर रही है। आज पूरी दुनिया नमस्कार, प्रणाम, अभिवादन पर आ गया, हाथ मिलाने छोड़ दिए हैं। जब हम पहले पैर हाथ धो करके घर में आते थे तो लोग हंसा करते थे, लेकिन आज वही चीज को पूरी दुनिया फॉलो कर रही है। तुलसी पत्ता का सेवन निश्चित तौर पर करें, यह एक बहुत बड़ा एंटीबायोटिक है। अगर आपके घर में तुलसी माता का पौधा नहीं है तो जरूर अपने घर में तुलसी माता का यानी तुलसी वृक्ष का पौधा लगाएं। तुलसी माता का पौधा लगा करके प्रतिदिन 5 तुलसी पत्ता का सेवन जरूर करें। परिवार के सभी सदस्यों को 5-5 पत्ते तुलसी पत्ता का सेवन जरूर कराएं। इस वायरस में यह आपके लिए रामबाण होगा। साथ ही साथ मेरा मानना है कि हम लोगों को मेडिकल साइंस को सम्मान करना चाहिए और आयुर्वेद को भी जरूर बढ़ावा करना चाहिए, क्योंकि आयुर्वेद में महाशक्ति है। आयुर्वेद से अभी इस कोरोना वायरस महामारी में बहुत सारे लोगों ने अपने आप को बचाया है, अपने घर में रह करके बहुत लोगों ने इलाज किया है। तो आयुर्वेद की तरफ भी लोगों को झुकाव होना चाहिए। अपने इष्ट देव की रोज आप पूजा करें और अपने ऊपर आत्मविश्वास बनाएंगे। मुझे लगता है कि यह जो बीमारी है सिर्फ और सिर्फ मेंटल गेम की बीमारी है। 90% लोग जो मर रहे हैं वह मानसिक असंतुलन, डर के कारण मर रहे हैं। मुझे लगता है कि कोई भी बीमारी हो, दुनिया में जो भी व्यक्ति जन्म लिया उसको मरना है एक दिन, तो मृत्यु को आनी ही है, तो मृत्यु से क्यों डरना। और मृत्यु पर विजय प्राप्त कोई नहीं कर सकता, हाँ परिस्थितियों पर विजय प्राप्त कर सकता है और उस परिस्थितियों से आगे निकल सकता है। इसलिए आप अध्यात्म की तरफ मुड़िए, विश्वास मानिए, इस कोरोना वायरस महामारी पर विजय प्राप्त होगी। और मुझे लगता है, मेरा कैलकुलेशन के आधार पर, दिसंबर 2021 से 99% बीमारी पूरी दुनिया से समाप्त हो जाएगी और 2022 से जो बीमारी रहेगी वह सामान्य जो फ्लू रहता है उस फ्लू के रूप में रह जाएगी और पूरी दुनिया जो है वह फिर से अपने रास्ते पर चलेगा। मैं राकेश जी आपको बहुत साधुवाद करता हूँ, माँ भगवती से प्रार्थना करता हूँ कि आप स्वस्थ रहें और इसी तरह के कार्यक्रम को पूरी दुनिया में जोड़ करके करते रहें ताकि लोगों तक अच्छी बातें पहुंच सके। मैं अपनी बातों को विराम
जी अभी विराम आपने दिया है, लेकिन अभी आप रहें, हमारा 1 घंटे का कार्यक्रम है,
मैं आपके साथ हूँ।
जी धन्यवाद।
मैं एक छोटे से मंत्र त्रिपुर सुंदरी राजराजेश्वरी के महामंत्र से अपने बातों को विराम दूंगा और मैं बातों को और लोगों को सुनूंगा।
जी
ओम सिंदूरारुण विग्रहम त्रिनयनम मणिकिमौलि अस्फुरा तारानायक शेखराम अश्मित मुखेन मापेन बक्षोरुहाम पाणिभ्याम मलपूर्णं चस्कं रक्तोत्पलं बिभृतिं सौम्यारतगढश्चरणां ध्यायेत् पराम्बिकाम् अरुणां करुणां तरंगिताक्षी धृत पाशांकुश पुष्पाण चापां अणिमादिभिरावृतां मयूखरमित विभाग भवानीं ध्यायेत् पद्मासनस्थां विक्षत बदनां पदं पत्रायताक्षीं हेमां भां पीतवस्त्रां करकलितशिद्भुवां परांगीं सर्वालंकारयुक्तां सततां अभयरां भक्तनम्रां भवानीं त्रिवेद्यां शान्तमूर्ति सकल सुरुणतां सर्वसंप्रदात्रीं सुकुंकुन बिल्पेन मलिकचुंबकस्तूरकां संबंधित तीक्ष्णां ससर चापाशांकुशां आशीष जन्मोहिनी मरुणमाल भूषांबरां जपा कुसुम्बासुराम जप विधो अश्मेरम दिकाम। महाशक्ति त्रिपुर सुंदरी राजराजेश्वरी उन सभी व्यक्तियों के अंदर शक्ति दे जो शक्ति में, ईश्वर में विश्वास करता है, उनको दीर्घ आयु दे और इस कोरोना वायरस महामारी में उन्हें विजय प्राप्त करने की शक्ति दे। यही कामना के साथ हरि ओम तत्सत। हरि ओम तत्सत।
बहुत अच्छा आचार्य जी, बहुत अच्छा, वेरी वेल, आपने very elaborative manner you have just placed your view and just enrich us with the mantras and the mantra shakti and whatever the ethos of the Indian culture, power of the Vedic culture, just we have realized, we have been realizing, and the world has just adopted the formula of Ayurvedic, but we're not going to discuss the Ayurvedic and allopathic because Dr. Akshita Gupta is BHMS MD and Dr. Raj Vyani is a MBBS and ENT and all the expert up there. So here we are just to discuss. Now I'll come to Alankrita Manviji after the heart-touching and so elaborative manner Acharya Shailesh Tiwari enrich us. So now she is there. Alankrita ji?
Yeah.
Oh, yeah, just actually frame was changed. Just I was just looking at you. So just you tell us how to balance the mental health in this pandemic way, and how just you healing, or how just healing the concerned person. You also healing the so many person every day. Just with this who are in the grip of corona, and you have seen how the pandemic is going to be curse for the humanity.
A very good evening to all of you. First of all, I would like to thank Kumar Rakesh for inviting me to this Global Governance show. And the show itself is very important because it is the need of hour to understand how we can deal with the mental health issues, which is a matter of concern for the whole world, and especially country like India, where we have very less holistic knowledge and very less holistic education. It's not been introduced in schools. And like I really liked what Dr. Anita just said, that mental health is
Akshita,
very...
Dr. Akshita.
Yeah, Prachita, sorry. Mental health issues are always least bothered in our country. So we all are in this hypochondriac state of mind where a slight sneeze or a slight fever gives us a chill that, oh my God, what's happening to me? And every small little problem in our body seems so like hypochondriac state is a state where we feel that we have this problem. So many diseases, a person itself assumes that something has happened. So, and especially when it comes to children, they are having such a hard time because they are so confused. They don't know, they have not seen the world yet, like my own son and the younger one, my niece. They're so confused that what's happening outside and what is this virus, why is it killing people, and what's happening with at this hour, this pandemic, some education related to how we can deal with this problem mentally, especially how kids can deal with this problem. Of course, schools are giving so much attention on children so that they can deal with it, but still we need to understand the whole situation, that how we can come up with this whole problem. Now we as human beings have tremendous energy to deal with all sort of crises. These are the biggest crises we have faced in the years now, and this pandemic, this crisis situation. See, we have our parasympathetic, sympathetic nervous system, but of course, during the time of crisis, in the time of crisis, of course, both the nervous systems starts working, and human beings find a way to deal with the crisis situation. But of course, at this moment, the minds are confused. The minds are in so much stress because, of course, the frequencies, the energies around us are very dense, because so much happening in the society itself, so many people suffering, dying every day. So what I tell all my clients, and what I deal during my healing session, I tell all my clients that the healing is in itself with you. Like what Shailesh ji just said, that fear is the biggest problem. Once we have the faith, once we don't put the subconscious thought of fear in our mind, half of the problem is over. Now, this water has tremendous energy. The 5 elements around us, air, of course, pranayam in the morning helps us a great deal. Then we have some apran vidya. Then, of course, 8 times when we have this water, I always tell my clients this water has the energy to absorb and it absorbs the positivity and the negativity both. So when we energize the water, the first water in the morning we take, and we pray that this water is flushing out all the negativity from us. And 7-8 times when we have this water with the purified intentions, it works. Air, of course, and of course the sunlight in the house, and of course the living energy in the house. This is the time when we can deal with the hidden talents, creativity, the love we shower in our family. Of course, we know there are certain foods which have the serotonin, oxytocin, serotonin. There are such chemicals which produce happiness in our brain, and there is certain food like bananas, strawberries. So many fruits have certain amount which raises the chemicals, happy chemicals in our brains. So we can, of course, eat certain fruits, and of course the good diet has a lot of role dealing with, because what we eat has effect on our mind. And of course a little walk, exercise, the adrenal rush in our body helps us to maintain the happiness index. And little bit of yoga every day, say 10 minutes of yoga in the evening, and 10 minutes of yoga when we start our day, it helps a great deal. And of course, apart from yoga, a little exercise, if not exercise, just a walk in the house helps a lot. And the breathing exercise, and the creativity which we have been thinking jab time milega to hum ye karenge. So the reading, writing, painting, of course the creativity helps us to brings that hormonal balance in us, to help to have that hormonal balance. Of course, music changes the frequency of the room, of the environment. So we have the mantras in the morning, we have the music which raises the happiness index. So some of the exercise, music, and of course the energy from the five elements, and the love which we have, and the bond of family bond, of course. So these are small little things which are helping us to deal with the crisis situation. And of course, sharing our emotions is very important. Sometimes we stop sharing. So at this time, whosoever you feel that understands you, you should give a call, and you should share the emotions. You should share what is going on in your mind, how you're dealing with this crisis situation. So talking, of course, helps a great deal when you know that somebody is there, somebody is understanding you. Apart from happiness varies person to person, but at some level we all humans are same. And when it comes to healing, I always tell my clients that you sit straight for 5 minutes, have a deep breathing, and the breathing should not be from the chest. It should not be the diaphragmatic breathing. The breathing should be with the stomach, and when you breathe, your stomach should come out, and when you breathe out, the stomach should get in. So have a deep breaths like 10 times or 20 times in a day. And of course, I tell my clients for the chakras, when your chakras are in balance, your 7 chakras, and in the morning when you get up, you just raise the energy of your body and chant the mantra you believe in. And I always use these bowls, because they have the sound has healing effect. So I use it so many times in a day to charge and heal my day. And of course, then I put myself in the circle when I get up and say I am I'm healthy, and I'm protected throughout the day. So in the room, of course, the lights which we use in the room has lot of effect on our mood. The essence, like I use lot of lavender, rose, and jasmine in my own house. I use lot of plants, the living energy around. And during this pandemic time, we can do lot of horticulture, like some we can do a lot of work, like हम plants लगा सकते हैं. Plants के साथ आसपास जब living energy होती है कहीं भी, it raises and uplifts our mood. So there are lot of things which we can do to heal ourselves. And once our aura is sealed, then of course the negative frequencies from outside, the negative frequencies and energies, they get depleted, and the new and fresh frequencies we can raise, and we can raise the the same when, because we all are connected. If one house is feeling good, better, then the other one is also get affected, because somewhere we all are connected. So at this moment, of course, depression is very, very much prevalent all around us. But there are a lot of things which we can do to fight with this depression. And of course, accepting this, yes, there will be negative thoughts, there will be negative emotions, whether we are doctor, whether we are healers, whether we are journalists or whosoever, we all deal with negative emotions. Now, accepting those negative emotions, because we know we are dealing with the crisis situation where we it has a lot of impact on our work, lot of impact on our social lives. A man is a social being, and of course, when we don't have that social interaction, it affects the mind very much. So, but there are a lot of things which we are not
Yeah.
doing in the
So,
past.
Lakshmi,
We can
I'll just
utilize those.
we'll take on the discussion also how just the mental wealth, and you have a lot of knowledge also and a lot of energy just to convey us and just teach us about the teachings, how just you practice every day and just giving the teaching to the others also. So I'll take the inputs from the Rakesh Tiwari ji. He's from Canada, a senior journalist at the group, CMD of the media group, the Hindi Times group. So he has faced this problem in his house. He has started a campaign about the mental health in Canada, in India, and globally. He has been doing so many programs for mental health. Actually, he has, so sorry to say, he has lost his son, young son, due to this mental health, due to the negligence. It is already he is alleged by the local hospital. So that was the main reason actually. So can you, Rakesh Tiwari ji, can you just elaborate in this pandemic time how you are, just you and Canada, in feeling like now this situation is same everywhere. Everybody is just feeling unsafe, full of fear, full of so many dicey things. So can you just share with us how just in Canada, how the people are just facing same like here
जी
and something a better position and better condition in Canada, please.
जी okay thank you so much Kumar Rakesh ji and all the panelists who are here and thanks for the kind introduction. Definitely, as you mentioned about my son who passed away in 2014 in the hospital, and still, and that's the time I come to know about the mental health. What is mental health for me? As along with anybody and everybody, normally I was thinking that okay, mental health is the people who are in financial trouble, some family trouble. They are, but for the kids whom you provide everything, but what kind of trouble they can have it. Now I will say that mental health and corona, as corona is indiscriminatory, it doesn't discriminate anybody. You are rich, you are poor, you are this religion or that religion. Corona doesn't discriminate. Same way is mental health. Mental health doesn't discriminate. You can be as young as 15, 16, 18, 20, or you can be old for various reasons. I will say that unfortunately, the whole world has ignored the mental health. For us, mental health means if somebody has a mental health issue, we call them pagal. Okay, we call them psycho. We call them whatever the name we call them. We pagal hai. So that's like a kind of abusive term. But my humble understanding, uh, I will say 90%, maybe more than that, of the world population is suffering through the mental health. Some, and how you are managing, that's the only issue. You are not running away, but if you see the people who are in the topmost position, they can be doctors, they can be ministers, and when their acts come, and you think that this must be crazy. The person, how the, and while the person on the outside was behaving normally so nicely this way or that way. But as I mentioned, unfortunately, mental health was ignored by the whole world. The whole world, I will say that especially the people who are working in the health field. So you can see that thousands of experiments, thousands of good things have been brought for the nails, for the hairs, for your skin tones, for any reason, for whole body. But which is the most important thing is our mind, our mental health status that was ignored totally. Means I'm not saying that there are no hospitals. I'm not saying there are no medicines. I'm not saying there are no doctors. But it was not never given priority which supposed to be given. I will give my example of here in Canada. That in Canada you'll be shocked and surprised. At least I was shocked and surprised for sure. That within 10 years period of time, which is the CTV, Canadian television channel,
Yeah,
which is one of the
that's some
most
channel.
prominent.
Yeah,
There are
yeah,
two channels which
yeah.
are very prominent. Yes, CBC, Canadian Broadcasting Corporation, and CTV. So CTV has done a program which is called the Suicide Watch, and that was they have done a 2 years extensive research and study that what is happening in the hospitals, because my son died in the hospital. He was not having any health issues other than the mental health issue, and where he has tried to hurt himself. I took him to the hospital. He was in a hospital's care, and they're supposed to take care of him. And they assured me, and I was assured, he's in a hospital. He's in a good care. There are doctors who are there. There are security personnel are there. There are nurses who are there. He cannot do no harm. I was in this misconception. Now, uh, my son died, unfortunately, on 26th of June. He stayed over there from 16th June to 26th June. Means 10 days he stayed in the hospital over there. And they were telling me that they were going to transfer him to the general ward, means where according to themselves he was doing better. And what I come to know, on 26th of June he died. Okay, in questionable circumstances, where hospital and the people are responsible. I'm not blaming any individual person, but that shows the carelessness in the health field are the people who are dealing. I'm not blaming one person over there. Means even I'm saying that those people who are treating, the doctors, the nurses, even they need the treatment too, because they are human being over there. Maybe they become too, I will say, immune towards it. But for them is patient is just a number who came and gone, and maybe they were thinking the same thing, that this person is crazy or mental or pagal. Okay, so our way of thinking about the mental health has need to be changed. We did not discuss, we did not talk about it. I'm glad that Corona is here in that way.
Rakesh
In a,
Tiwari
I
ji,
will say,
very
blessing in
important
disguise,
just you raised.
where we are focused, we are
Rakesh Tiwari ji,
focusing on
Rakesh Tiwari ji.
GG.
Rakesh Tiwari ji, whatever
Yes,
you raised, very valid reasons. The reporting of
Very
mental health, reporting of mental health is not proper, and that is already ignorance, not in India, as well in Canada also. Just as you said, I'll also take the inputs from Dr. Rasbiani of the status of the USA.
let me just let me just complete it. Okay.
No, I'll come to you now. Again, I'll come to you. Then you'll add now. No issue. So I'll take Anita ji. Just do you think that reporting of mental health, just to keep an eye on the reporting and the media in India. So do you think the reporting of mental health is not proper, not as much as they needed? Do you think so, Anita ji? Unmute yourself, please. Please.
Sorry, Rakesh ji. First of all, we have to understand that what kind of a situation is, and in this atmosphere, how we have to handle ourselves. Because everywhere there is some kind of hue and cry. Many people, millions of people, they have lost their own, and we are locked in our house. Especially if we will talk about the children, they are not going to outside to play. They don't have any physical work. They don't have any proper studies. the 10th and 12th examination has cancelled. It's not only about India. I'm talking about the whole world.
Yeah.
And the data is saying there is a report that's saying that maximum children who will be affected mentally after this corona, because the
Women,
routine has
women
totally.
also, women also, children, women
Uh,
also, adult also. Yeah.
Yes, yes,
Yeah.
but the children will be the most, because they have their own thoughts, and if we will tell them that do yoga, they don't believe in that, because they are in that age. They just want a vibrant environment, the crazy things to do, and live their life in their own style. They want their own routine. We have to go out. We have to do studies. We have to play. I need my friends. I want to get any kind of get together, but if we will talk about the elders also, jobs has gone, lifestyle is not there, daily routine we are not following. And if we will talk about the elder mental, especially the women, they are stuck in the house, and they are living as a very very tight routine, daily routines. So they don't have any time for themselves. So these are the things which we have to understand, and we have to understand that how we should rectify it, how we should control. Even the government is working on, there is a political hue and cry, but the government is not working on this very important area, that we have to save our citizens with their mental health. They are not working on that. They don't have any program, they don't have any policy. But as a part of this world, as a citizen of this country, and as a resident of this society, I just want that we should, on our own self, we should create. We are doing virtual meeting, we are doing virtual jobs, we are working from home. We have lots of activities from virtually, with which virtually we are doing. Why not there is a virtual kitty parties? Why not the government is creating new games for children that they can play virtually? There should be some virtual counseling from the government side to how you handle all this situation, because this is life. The pandemic is a cruel fact, and we have to accept it. We cannot cry, and we cannot deny it. We have to accept it. We are in a pandemic period. We have
Yeah.
any the invisible enemy is around us, and we have to deal with that enemy. And the thing is that the most important, master your mind. You have to control your mind and thought, and live your life with full of
No,
heart.
that's okay.
Flow
That's
of
okay.
flow of
Anita ji,
emotion
my question was
should open.
my question was about the reporting and how the media is behaving with the mental health. So I'll take the from Dr. Raj Rayani.
They are just
Dr. Raj,
hiding,
yeah, yeah.
but I
I'll
feel
got
they
so
are not just making aware. Yeah.
uh, that is aware both of awareness, and thus the media awareness and the public awareness, both of them. Dr. Raj Rayani.
Media should also play an important role. They are sending
Yeah.
their reporters outside just to collect negative reports. They should run
Dr. Raj,
a
Raj Rayani,
series
I'm
of
listening to you.
programs that can
Dr. Raj.
create a vibrant atmosphere in every house, in every
See,
home.
no, that's okay. So I'll take Dr. Akshita Gupta. Just how you think, just how many types of, just you discussed about the patients, and about the patients, just you, how just you find this patient of this mental anxiety, how differentiated the mental problem, what is your experiences?
They are very bad experiences at what I have felt in these times. What happened basically, if you see the people are in the hospital, if they are in a group of, there are 10 patients in a ward, in a room, if one dies, the other person get panicked. They don't want to go to the hospital. The sudden anxiety starts. It starts building. They just think there is no positive, and the doctor comes and says, "उसमें positivity जागृत करो, patient में positivity जागृत करो." How will you imbibe positivity when everywhere you are seeing bodies and bodies? How will you imbibe the positive vibes? So we have to see how to work in these times. Although it is a very tough time, no person can go and meet. The people are becoming negative. घर में एक को कुछ होता है दूसरे को भी हो जाता है because it's ultimately in the mind. क्योंकि they are the closed ones which everyone is going through. As you said, very highlighting very good point which I felt कि aware कि बच्चों के लिए virtual games करें. They are already there. The problem is of the awareness. More is awareness is lacking. There are games, everything is there. In this times, there is nothing lacking. It is just how we utilize that time.
No. As a doctor, just you are running the clinic for the
Yeah.
Psychiatry. So my question is,
Yeah.
which type of patient just you are facing more? Just what type age from the kids to the old ages? So how many type? Which type of patient? What is the number of patients?
Majorly teenage patients. Because see,
My
if I
goodness.
say you, the main was like in 10th and 12th, they came to me. They say कि एग्जाम का पता नहीं है, पढ़े तो पढ़े क्या, करे तो करे क्या. We don't know 12th के एग्जाम होंगे नहीं होंगे. होंगे तो
Oh
हम
my
आगे
God.
बाहर जा पाएंगे या नहीं जा पाएंगे. अभी रिसेंट में है कि कोवैक्सीन लगवा ली है एक मेरे पेशेंट ने. अब नेक्स्ट क्वेश्चन इज यू आर नॉट अलाउड टू गो आउट. नाउ व्हाट टू डू अबाउट द सेकंड डोज? What to do? Here the confusion starts. Here the anxiety starts. Here the panic starts. What to do? These are the simple things कि government ने launch करी vaccine. We must see things what to go about. The people are
Yeah.
not clear. The kids have the anxiety. What to do? Now exams cancelled. The other query is how will be the breakup? How will be the exams? How will be the exam? And where
So
we'll not get some
exam
infection.
stress is more important. Exam stress is the
Very much important.
most of the cases, and you have just facing the problems of the youngers, teens, just who are just for the exam phobia. Just you can say the exam crisis
They have
and
lost
anxiety.
interest in everything. They have lost
Yeah.
interest in everything. They can do a lot of things. One says
So
कि I'll enjoy something.
just Shailesh Tiwari just shared his thoughts, and Alankrita Manvi also shared is how just he healed the person
Hmm.
concerned. So
Hmm.
as a medico, I'll come to you, Rakesh Tiwari ji, after Akshita.
Yeah.
How Akshita, how you cure this type of problem to the young and teens?
First of
That
all,
is
I
important.
explain to patients. Yeah, that is very important. First
Yeah.
of all, I explain to their parents. You have to be very patient with your kids. You have to understand them. Because see, we are just in between our families. We are not going anywhere. We are just having video calls. But that doesn't suffice at all. Some patients come and say हम अपनी friend को call करते हैं, वहां से भी कुछ और ही आता है. So it's better we don't call only. So वहां से everywhere which you call, what you do, you are getting only and only negative vibes. So mainly, I tell their parents, be positive. Just help them, counsel them, talk to them. Don't leave them alone. Don't leave them alone. Try to make them understand. It is time. It will go on. Nothing lasts for long. Be positive. So I
Do
just
advise
tell
some
them
medicine
to
also?
interact.
Do advise some
Yeah.
medicine also?
Yeah, being a
Okay.
homeopath, I give homeopathic medicines which help them a lot. But mostly, what I feel, they feel much better by talking and counseling. That
Yeah.
is the important. What I
That's
felt
good.
in my practice, it's like talking helps them. The majorly people don't are not very much communicative with their family. They feel what they will think about them. They will not. They
Yeah.
will start
That is
judging.
important. That is important.
So communication
I just want to read a quote of a teacher. A teacher,
yeah.
Please,
when
please,
when
please.
the 12th examination has cancelled, lots of memes we have seen on Twitters and Facebook and other social media platforms. That but the teacher name is my daughter's teacher. She taught her political science. There is a very nice quote she has posted on social media that it's a humble request as a teacher to everyone to stop making memes and mocks the students of class 12 whose examination have just been cancelled. You have absolutely no idea the trauma has batch has gone through. So kindly have you some sensitivity and stop mocking children? No, it's not funny to laugh at someone who have spent sleepless night pondering about their future. Uncertainly, uncertainty, speculations, sleepless nights, anxiety issues, depression. This is what the children suffered for these all these months. I am a witness of all this, so please be kind. Stop circulation of these kind of memes and laughing situation on them because they are the sufferer. They
Yeah,
want their
that
life.
is that
They
is the main
want their
problem. Yeah,
exams.
yeah. Just as Dr. Akshita Gupta mentioned, and you also mentioned, this is the main problem. The youngsters, that's who are facing the 10, 12
Actually,
examination.
they are not
They-
able to know what is going to happen. Confusion,
yeah, you are
and
right.
only
Yeah,
confusion.
Rakesh Tiwari ji, just something you want to mention, please. Rakesh Tiwari ji, please unmute yourself, please. Unmute yourself. Please unmute. Please go ahead.
I'm doing it.
No, unmute. Unmute, please. Rakesh Tiwari.
With yourself, I did it, but
Please.
somewhere me.
Any problem? I think there is some. We're not hearing you.
He's not able to unmute, I
Yeah.
think.
Please unmute. Tiwari ji, please unmute yourself. Yeah.
Okay.
Yeah, he's done. Oh, again and again
Oh.
mute.
Yes,
Yeah,
I'm
now
doing
okay.
it. I'm trying to.
Please.
Now okay?
Yeah.
Yeah.
Okay, hopefully.
Yeah.
Okay, hopefully. Okay.
Don't touch
As I
now.
mentioned that mental health was ignored, but now as I mentioned that is a blessing in disguise. I will suggest is I'm taking totally different view on Corona. I think this is the introspective for us to every human being. We have been running away from our families for the money's sake. We have been running away from our children because we wanted to build money and do whatever. We were running away. So Corona has brought us to mental health, to the family, to do that, to value all those things which we were ignoring it. We were ignoring our physical health. We were ignoring our mental health. We were ignoring our families. We were ignoring everything. Let me address this very interesting thing, which is I have it, and I will suggest that this is according to the WTO, means what? Sorry, not WTO. I will say mental health. About mental health, what has been said by the World Health Organization WHO.int mean international. What is saying that? It's saying that stop, breathe, think, connect with the people, have a healthy lifestyle, be merciful to other people. Means दया करें, खुद पर होने पे दया करें, जरूरत पर मदद लें. Tell me, everybody who's here, that this has not been taught by our scriptures, our shastras, our dharmagranthas, that stop, breathe, don't run too much, think about it. You are, Shastriji said, Acharya ji said that, Vasudha Kutumbakam. Yeah.
Okay. Tiwari, really,
and this must
really you
do
have
whatever
mentioned,
we have to do.
just we are running out of time now. I request you, you mentioned the ignorance by the society, now ignorance by the ignorance by society, ignorance by the doctor also, ignorance by the people also. I'll take the quotes just from Dr. Azvayani. Just how do you think, after listening the all quotes and all the healers, we have just doctors and the priest and the cosmic healer and the media person and from the all society, just how do you think how they just will combat this COVID and how to just control the diseases of mental health as a experienced doctor of the more than 30 years? Dr. Azvayani.
Yes, I think I applaud all the knowledge and expertise of all the panelists who are here. They have wonderful input and suggestions how to combat with this very, very difficult problem. As everybody said, it is underdiagnosed. There is no question about it, because psychiatric illness is considered a taboo in India. And as soon as somebody is assigned a label, he has a psychiatric problem, it becomes very difficult for the society and family and others to accept it. And they think the guy is totally crazy. So unless that taboo is removed, people will not come forward to take the treatment and whatever is help he needs. Having said that, but during Corona time, there is a more understanding and acceptance of this problem all over the world. And there is no one therapy which is right. It has to be combination of different therapies, which is allopathy as well as the Ayurveda, homeopathy, and meditation, yoga, breathing exercise. All these things has to be combined in a way where it should be a holistic approach, and with the combination of all the pathies involved into this. So that should be the take-home message. First and foremost is educate the public that this is not actually a big problem, in the sense that by telling yourself you're anxious, you're afraid, you're scared, and you have anxiety, or you're getting depressed is normal, which is, and it's happening to almost 40 to 50% of population currently during Corona time. So that is acceptance level will increase, which shows like this public education is the key. And once more and more people become aware that this is a problem and this is a treatable problem and preventable problem, once we have this education going, then people will understand. Then we have to categorize this in the different categories. One is helping yourself first. Before you help others, you need to be helping yourself first. So I need to be in a good mental state, and I should take whatever help I need before I start helping others. So then once I help myself, then I go to others and say, look guys, this is what I have done. This I went through and it helped me. So now is your time to take the help. You can self-help, or you take the help of experts, such as all the panelists who are here.
Yeah.
And the help can come in from different ways. Simple techniques, which is breathing exercise, eating healthy, and most important part is stay away from the news. Once you sit home, you are hearing all this crazy news 24/7.
Yeah, you're right.
Which is actually not helping general population at all.
Absolutely.
Which is making people more anxious, depressed, and desperate. People are running around seeking medications when they don't need, thinking that they have COVID when they don't have COVID. It has caused more problems. As you see in our Indian society, they took prednisone when they should not have taken. They're hoarding the medications. So this all has that. It's an educational problem, and we need to educate the society that look, this is
so nice. So nice, Dr. Rajbani. So nicely, just you have placed your views, and as a doctor, and just this is a nutshell, we can say what we have discussed here with the spiritually, mental.
The most beautiful thing was the integration of all. We need to move together. No pathy is completed in all.
No, Dr. Akshita Gupta, the time const. Tiwari ji, we will next the program again. We can make the series of program on mental health, no issue. This is your channel on 1 hour, 2 hour, 3 hour, but we have just constraint of time now. We have the 1 hour just we extended for the 5-7 minutes. So just we have all listened to each other. We have listened to each other. Just and very nicely view placed by Alankrita Manvi ji, Acharya Shailesh Tiwari ji. So in which with the mantras and Dr. Akshita Gupta, Rakesh Tiwari ji, Dr. Rajbani ji, all of just here just to aware. So this nutshell we can say educate, aware, communicate, and just to energize, just to first yourself and then society. They can fight this COVID of the China Wuhan virus, and we'll fight against that. Either China and China virus will conquer like anything. So nicely, just all thanks to you and thanks to all. We'll meet again for the new subjects and with the new topics for the country and for the global society. So nicely, and thanks and namaste, Jai Hind,
Hare
Jai
Krishna,
Bharat.
Hare Krishna, Hare Krishna.
Thank you, everybody.
Hare Krishna.